A burn is one of the most common types of injury, but understanding a burn involves much more than simply looking at damaged skin. To understand how serious a burn is, we need to answer two important questions. How deep is the burn? And how much of the body is affected? In this lesson, we'll start from the very beginning and gradually build our understanding of burns, from what causes them to the different degrees of burn, the rule of nines, quick memory tricks, and finally how burns are managed. So what exactly is a burn? A burn is an injury to the skin or deeper tissues caused by a damaging source. The source may be heat, chemicals, electricity, radiation, friction, or extreme cold. The severity of a burn depends mainly on three things: the depth of the burn, the size of the burn, and the location of the burn. Depth tells us how deeply the tissue has been damaged. Size tells us how much of the body's surface is affected. And location matters because burns involving areas such as the face, hands, feet, genital region, or major joints can have greater clinical significance. So, before we talk about treatment, we first need to understand how burns are classified. Types of burns, classified by cause. Burns can occur through several different mechanisms. Thermal burns. These are caused by heat. Examples include flames, hot liquids, steam, or contact with a hot object. Chemical burns. These occur when acids, alkalis, or other corrosive chemicals damage the tissues. Electrical burns. These occur when electrical current passes through the body. An important point here is that the skin may not always show the full extent of the underlying injury. Radiation burns. These can result from sources such as ultraviolet radiation from the sun or medical radiation. Friction burns. These occur when the skin is damaged by repeated rubbing against a surface. A common example is road rash. And finally, extreme cold can also cause significant tissue injury, such as frostbite. So remember, thermal, chemical, electrical, radiation, friction, and cold. These describe what caused the injury, but now we need another classification. Instead of asking, what caused the burn, we ask, how deep did the burn go? To understand burn depth, let's first understand the normal layers of the skin. The outermost layer is the epidermis. Below that is the dermis. Under the skin is the subcutaneous tissue, which contains fat. Deeper structures include muscle, tendons, and eventually bone. This is important because the deeper the burn travels, the more tissues and structures it can destroy. And that brings us to the degrees or depths of burns. Traditionally, burns have been described as first degree, second degree, third degree, and fourth degree burns. Today, healthcare professionals often use terms such as superficial, partial thickness, and full thickness burns. Because these terms describe the actual depth of tissue injury more accurately, let's take them one by one. First degree burn or superficial burn. A first degree or superficial burn affects only the epidermis, the outermost layer of the skin. Think of the classic sunburn. The skin becomes red, dry, and painful, but there are usually no blisters. A simple way to remember it is red, dry, painful, no blisters. Because the injury is superficial, the skin generally heals without significant scarring. Second degree burn or partial thickness burn. Now we go deeper. A second degree or partial thickness burn involves the epidermis and part of the dermis. These burns commonly produce blisters, swelling, moisture, redness, and significant pain. The skin may look wet or raw, and depending on how deep the partial thickness injury is, healing can vary considerably. So remember, second degree equals blisters, moisture, and pain. Third degree burn or full thickness burn. Now we reach a full thickness burn. A third degree burn destroys the epidermis and the entire dermis. The skin may appear white, brown, black, or charred. It may also feel dry and leathery. And here's an important concept. A very deep burn may actually have reduced sensation or little pain in the center of the injury because the nerve endings have been destroyed. So don't assume no pain means no serious injury. In a full thickness burn, the opposite may be true. These burns often require specialist treatment and may require surgical removal of damaged tissue and skin grafting. Fourth degree burn. This injury extends beyond the skin and subcutaneous tissue into deeper structures such as muscle, tendon, and bone. Think, fourth degree means beyond the skin. These are extremely severe injuries and require urgent specialist management. Let's make the whole classification easy. First degree, red and dry. Second degree, blisters and moist. Third degree, leathery and destroyed. Fourth degree, beyond the skin. So as the burn gets deeper, epidermis to dermis, to full skin, to deep tissues. Now we know how deep a burn is. But there's another important question: how much of the body is burned? This is where we use something called TBSA. TBSA stands for Total Body Surface Area. It represents the percentage of the body's surface that has been affected by the burn. For example, if a patient has a burn involving approximately 20% of their body surface, we describe it as 20% TBSA. And one of the quickest ways to estimate TBSA in an adult is called the rule of nines. The rule of nines is a rapid method for estimating the percentage of body surface affected by a burn. It is commonly known as the Wallace Rule of Nines, associated with A.B. Wallace, who published the method in 1951. However, the historical development of the concept involved earlier work by Pulaski and Tennyson. The important thing for us clinically is understanding how the system works. In a typical adult, the head and neck equal 9%. Each arm equals 9%. The front of the trunk equals 18%. The back of the trunk equals 18%. Each leg equals 18%. And the perineum equals 1%. Add everything together and we get 100%. You must have wondered, why these specific percentages? For example, why is the head considered 9% in the rule of nines? The 9% is an approximation of the surface area of the adult head and neck compared with the entire body's skin surface. Imagine taking all the skin covering your body and spreading it out flat. That total area equals 100% TBSA. Now imagine isolating the skin covering your head and neck. It makes up roughly 9% of that total skin area. So when a burn completely covers the head and neck, burned TBSA approximately equals 9%. If only half of the head/neck is burned, approximately 4.5% TBSA. Why do we use this system? Because doctors need a quick way to estimate burn size, especially in emergencies. For example, imagine an adult has entire right arm burned, 9%, entire front of trunk burned, 18%, head/neck burned, 9%, total 9 plus 18 plus 9 equals 36%, TBSA burned. That means approximately 36% of the person's total body surface area has burns. One important distinction: TBSA equals total body surface area. It refers to skin surface area, not body weight, volume, or the percentage of the person's body that is physically burned through. And the rule of nines is mainly designed for rapid adult assessment. Children have proportionally larger heads and smaller legs, so a pediatric chart such as the Lund-Browder chart is more accurate. Here's a very useful way to remember the rule of nines. Think 9, 18, 36, 36. One head and neck equals 9. Both arms together equal 18. Both legs together equal 36. The entire trunk equals 36. And the perineum equals 1. So 9 plus 18 plus 36 plus 36 plus 1 equals 100%. Let's put it into practice. Imagine an adult patient has burns involving the entire front of the trunk and one entire arm. The front of the trunk is 18%. One arm is 9%. So the estimated TBSA is 18 plus 9 equals 27%. Therefore, this patient has approximately 27% TBSA burned. And this is why learning the rule of nines is more than just memorizing numbers. The adult rule of nines is not as accurate for children because children's body proportions are different from those of adults. For example, children have proportionally larger heads and smaller legs compared with adults. So for children, a more accurate method is the Lund-Browder chart. The palm method. What is the palm method? The palm method is a quick way to estimate the total body surface area, TBSA, of a burn when the burn is small, scattered, or irregularly shaped, making the rule of nines difficult to apply. The key idea is the patient's entire hand, palm plus fingers, is approximately 1% of their TBSA, so you can visually compare the burned area with the patient's hand. For example, burn approximately one hand leads to approximately 1% TBSA. Burn approximately two hands leads to approximately 2% TBSA. Burn approximately 5 hands leads to approximately 5% TBSA. Why do we use it? The rule of nines works very well for large, clearly defined burns, such as an entire arm or the front of the trunk. But imagine a patient has several small burns scattered across the arm, chest, and leg. It would be difficult to assign a whole 9% or 18% body region to those areas. That's where the palm method becomes useful. Easy way to remember: large, regular burn. Rule of nines. Small or irregular burn. Palm method. Child, Lund-Browder chart. Now that we understand what a burn is, how deep it is, and how large it is, we can finally talk about management. And the first thing to understand is that first aid and hospital treatment are not the same thing. Let's start with immediate first aid. A simple sequence to remember is stop, cool, remove, cover, refer. Stop first. Stop the burning process. Move the person away from the source of the injury if it is safe to do so. If clothing is burning, extinguish the flames and remove the person from the source of heat. The priority is to prevent further tissue damage. Cool next. Cool the burn. Use cool running water over the burned area. Avoid using ice directly on the burn because extreme cold can cause additional tissue injury. Do not use butter, oil, toothpaste, or other home remedies. The goal is simple. Cool the injured tissue without causing further damage. Remove. Next, remove constricting items. Rings, watches, bracelets, and other tight objects should be removed from the affected area when it is safe to do so. Why? Because burns can cause swelling. An object that fits normally now may become dangerously tight later. Do not pull away clothing that is stuck to the skin. Cover after cooling. Cover the burn. Use a clean, non-adherent dressing or a clean cloth to protect the injured area, and avoid deliberately breaking blisters. The purpose of covering the burn is to protect the damaged tissue from contamination and further injury. Refer finally. Know when the patient needs medical attention. Burns that are extensive, deep, involve critical areas such as the face, hands, feet, genital region, or major joints, or result from chemical or electrical mechanisms may require urgent specialist assessment. And remember, a burn can look small on the surface while hiding a much more serious injury underneath. Hospital management. ABCDE. When a patient with a significant burn arrives for medical care, we move beyond simple first aid. We begin with a systematic assessment. One useful framework is A. Airway. First, assess the airway. This becomes particularly important when there is a possibility of inhalation injury. Look for clues such as facial burns, burns around the mouth or nose, soot, singed facial or nasal hair, hoarseness, difficulty breathing, or a history of being trapped in an enclosed fire. Breathing. Next, breathing. Assess oxygenation and ventilation. A burn patient may have respiratory problems from inhalation injury, smoke exposure, or other associated trauma. Circulation. Assess the pulse, blood pressure, perfusion, and signs of shock. In major burns, fluid loss from damaged tissue and changes in vascular permeability can lead to significant fluid shifts. And this brings us back to something we learned earlier. TBSA. The larger the significant burn, the more important accurate assessment and fluid management become. D. Disability. Next, disability. Assess the patient's neurological status and level of consciousness. E. Exposure. Finally, exposure. The patient needs a complete assessment so that hidden burns are not missed. But while exposing the patient, we must also prevent unnecessary heat loss and hypothermia. So remember, A. Airway. B. Breathing. C, circulation, D, disability, E, exposure, fluid resuscitation. Now let's connect everything we've learned. For significant burns, clinicians may need to estimate fluid requirements. One traditional starting point is the Parkland formula. The classic formula is 4 milliliters times body weight in kilograms times percentage TBSA burned. The calculated volume is traditionally divided so that half is given during the first 8 hours and the remaining half during the following 16 hours. But there is an extremely important point. The formula is only a starting estimate. Fluid administration must be adjusted according to the patient's clinical condition and response, including appropriate monitoring such as urine output. So don't think of the Parkland formula as calculate it and give exactly that amount. Think of it as calculate a starting estimate, then carefully monitor and adjust. Let's bring the entire lesson together. When you see a burn, ask yourself 5 questions. Question 1. What caused the burn? Thermal, chemical, electrical, radiation, friction, or cold? Question 2. How deep is it? Superficial, partial thickness, full thickness, or extending into deeper tissues? Question 3. How much of the body is affected? Estimate the TBSA. Question 4. Where is the burn? Is it affecting a critical anatomical area? Question 5. How sick is the patient? Assess the airway, breathing, circulation, neurological status, and the entire body. And that's everything you need to know about burns, from understanding the different types and degrees to estimating TBSA and knowing the basics of burn management. If you found this video helpful, give it a like, share it with someone who might find it useful, and subscribe to Dr. How for more simple, clear, and practical medical explanations. Thanks for watching, and I'll see you in the next one.